Should you exercise when you have back pain? Will the exercise make the pain better or worse? Watch this video to find out the answer. Hello and welcome to the Back Pain Guide. I'm Duncan, a former sufferer of debilitating back pain, now turned physiotherapist who focuses on the treatment and care of other people, perhaps like yourself, who also suffer from back pain. The advice I give is a mixture of my professional expertise and personal experience, and I focus on trying to give the information I wish I had known when I was suffering from back pain. So should you exercise when you have back pain? This is a question I get asked daily by patients. And unfortunately, the answer has a little bit of nuance and complexity to it. So I thought I'd make this video giving a slightly more detailed answer so that people with back pain are best able to make more informed decisions for themselves. So the reality is that yes, exercise of the wrong type or intensity can worsen your back pain. However, the flip side of that coin is that if you stay completely inactive, the pain is likely to take much longer to resolve. So the process is really going to be about finding that Goldilocks zone of activity. Not too much, not too little, just right. This zone of activity will help you recover optimally without being so intense or too intense so as to exacerbate the issue. So personally speaking, I tend to advocate for getting back to activities pretty quickly or relatively quickly. And my personal experience is, as long as the risk of any injury is properly assessed, I usually want to get my patients up and doing as much as possible within their zone of comfort or tolerance. The main reason for this is that there really is inherent value in doing the things or the activities that you love. So whether it's going for a walk with someone you care about, or playing tennis with friends, or going to dance class with your partner, or playing with your children or grandchildren in the park, or whatever it is. Now, obviously these things are all physical activity and they have those sort of benefits associated with that, with that physical movement. But looking a level deeper, we do these things because they also provide something else that is good for us beyond simply working our muscles or our cardiovascular system. This is a phenomenon that's often described as the halo effect, which indicates that engaging in these beloved activities can carry over and have a positive effect on our pain experience, decreasing our overall feelings of pain and discomfort. Related to this halo effect is the quite clear understanding that engaging with these physical activities at an appropriate intensity, not too much, not too little, can lead to what we call pain habituation, which is the opposite of pain sensitization. So this is where the pain response to these activities can and often does decrease with gradual exposure to the activity. A really good, if not slightly crude example of this is the saddle of a cyclist. So over time, cyclists develop an ability to cycle for longer and longer periods without pain. So, initially a 15 or 20-minute cycle can be enough to force someone off their bike, due to discomfort in that saddle area. However, this can develop to many hours with no issue. So why is this the case? Well, yeah, there are some sort of minimal physiological changes that do occur, but sorry to be crude, but it's not like cyclists develop some sort of massive crotch saddle callus that protects their private areas from that constant contact with the bike saddle. This is an example of pain habituation. A once painful activity has become gradually less painful over time, and it's more of a systemic or neurological or even psychological response rather than a physiological change that's actually happened in the body. The other major benefit of getting back into those activities that you love, those physical activities that you love doing, is to remove the fear or anxiety associated with getting back into that activity. So if you love playing tennis, but you hurt yourself playing tennis, you will be understandably reluctant to returning to that activity, no matter how much you enjoy or love doing it. Graded exposure to this activity is normally the best way of removing these feelings of fear or anxiety. So how do we do this? How do we get back into our beloved activities knowing what is safe? Well, as I mentioned at the start, you need to find that Goldilocks zone of activity, not too little and not too much. I'm going to give you a few tips to help you find the appropriate zone for you. So firstly, most physiotherapists that I have worked with, or even osteopaths, will advocate for this 3 out of 10 discomfort level, which seems to be around the right level of discomfort or pain associated with the activity, where you'll start getting that benefit of poking into the pain without going too hard or too intense to potentially exacerbate the issue. So a 3 out of 10, 0 being no pain at all, 10 being the most pain imaginable, a 3 out of 10 pain is normally described as some level of tolerable discomfort. You're like, oh, there's something going on here that I'm just a little unhappy with, but I can manage it. This seems to be about the right level to gauge getting back into beloved activities. On top of this, if the pain gets worse during the exercise, this is generally not a particularly good sign and is indicative that you need to either stop or back off significantly. On the flip side, if the pain gets better during the exercise, this is normally a sign that you are likely doing some good. Of course, just assessing pain or discomfort levels during the activity isn't quite sufficient, and assessing how you feel after the activity is also really important. So if you go back to running or lifting weights or playing tennis or whatever it is, see how you feel the next day. Are you sore? And assess the type of soreness. Is it the soreness normally associated with general exercise, or is there something a little bit more concerning or a little bit more sinister that you're experiencing? Is it reminding you of the pain of your previous injury, the thing that you're trying to overcome? Also, on top of that, any pain or discomfort post-exercise that lasts for more than about 48 hours is generally not a great sign. So, even if it's not a soreness that's particularly concerning to you following the bout of returning to exercise, if it lasts for 3-4 days, this is generally a sign that you've maybe exacerbated things a little bit by going a little bit too hard or maybe for a bit too long. So indicative that you need to back off just a little bit. So although I advocate for getting back into beloved activities relatively quickly, on the flip side, I do advocate for doing so with a healthy level of caution. And some useful advice when getting back into exercise is to take what you realistically think you might be able to handle today and half it. So for example, if you think you can handle a 3-kilometer jog today, do 1.5 kilometers. If you think you could walk for 90 minutes, do 45 minutes. If you think you can get back to squatting 60 kilos, squat 30 kilos, that sort of thing. Now, I realize this can be quite frustrating for some people, but when assessing this, I always advocate for following the first rule of cooking, which is that you can always add, but you can't subtract. So I'd follow a similar concept here. You can always go back the next day and add a little bit more intensity or a little bit more volume or length to your exercise. So like with adding, salt to a pasta sauce or something like that, best to add a little bit and then taste, and then add a little bit more and then taste. Each taste is collecting useful data about the dish you're making, so you're assessing, not guessing, how much salt to use. So likewise with exercise, add a bit and taste, add a bit of exercise and assess the impact it has on your body in relation to those guidelines I outlined earlier. That way you can make an educated assessment of how much load you can actually tolerate. Unfortunately, it can be quite difficult to assess this without just giving it a go and seeing what happens. So this is why I advocate for a somewhat conservative approach to returning to exercise. However, if you just guess and start too soon or start with too much intensity, it's a recipe for re-injury and setting you back even further. The final piece of advice I'd offer in this context is that when recovering from a back injury, it seems that frequency of exercise seems to be more valuable than length or volume or intensity of exercise. So just an example of that, if you're working back to walking comfortably, probably 4 15-minute walks a day is going to be better for you than one 60-minute long walk, that sort of thing. When approaching the idea of returning to exercise or your beloved physical activities, I recommend you follow the following principles. Firstly, don't rely on complete bed rest to heal, and get up and moving as much as you can within tolerable limits. Start relatively conservatively. Take what you think you could handle today and half it. Focus on doing little but often, more frequently throughout the day, and progress slowly. I hope you found that information useful. Remember, you have the power to take control and move towards a pain-free life. If you enjoyed the video, please give it a like and consider subscribing to the Back Pain Guide for future videos and more valuable content. If you have any questions or perhaps suggestions for future videos, please leave them in the comments below. I'm here to guide and support you on your road to recovery. Thanks again for watching the video, and I'll see you in the next one.